Hello, everyone. This is Dr. Richard Fleming, and today is Monday, October 19, 2020. Since the pandemic of 2020 with SARS-CoV-2, there have been more than 40,272,000 infections worldwide, with more than 1,116,000 deaths. In the United States alone, there's been more than 8.2 million infections and more than 219,775 deaths. Galileo Galilei once is quoted as having said that all truths are easy to understand once they are discovered. The point is to discover them. I think for many people, there have been many mistruths and much misinformation disseminated about SARS-CoV-2. For some time, I've been posting on this YouTube channel and trying to explain to people that the reasons why people are dying with COVID-19 are the associated comorbidities that put them at increased risk for having a hyper-responsive immune reaction to SARS-CoV-2, producing an inflammatory thrombotic response, producing fluid, edema, inflammation, and blood clots that are killing people. It's easy to get lost in the forest for the trees. And it's easy to forget how easy it is to come up with an answer or to find the solution by just doing the very meticulous work that needs to be done to sort out why people get infected from a virus, this particular virus, under what circumstances, and what types of treatments are available. Now, there's a lot of discussion about the different types of treatments, and there's a lot of highly motivated individuals that are talking about which treatments they believe work and which ones they don't. I wish I could honestly say that the vast majority of the people that I've been listening to are looking at it from a scientifically objective position, but I don't think that's the case. They might be looking at it from a political position or an emotionally discharged position, but they're not looking at it scientifically or logically. The study that we just submitted this weekend, looking at more than 500 people hospitalized and roughly 1,800 people in the outpatient and inpatient setting, made it painfully obvious that the treatment of SARS-CoV-2 is not a single drug treatment. It never has been, and it never will be. There's a variety of treatments that we've been able to sort out, but we were only able to do that because we meticulously worked through the detail after having objective measures for looking at outcomes. The only way a scientific study can truly be done to find answers is to objectively measure outcomes and to try to look at all the variables and how they interact. There's over 3,000 studies posted on the National Clinical Trials Registry, and I'm sure there's others that people are doing that haven't been reported. And the vast majority are focused on one drug or another in their efforts to see whether people live or die. That is usually not the ultimate determination of treatment success, although it's a treatment success outcome, living or dying. But unfortunately, it won't provide answers about what a medication or combination of medications truly do. Depending upon your point of view, you have a very strong opinion about whether you should or shouldn't be wearing masks, whether you should or should not be receiving a vaccine. There is some scientific evidence on both sides of it, and unfortunately, there's a lot of scientific evidence that shows that depending upon the circumstances, you could go one way or the other on most of these topics. But the ultimate question is going to boil down to, are there treatments available for SARS-CoV-2? Fortunately, there are. And I think that once the paper comes out, there's going to be a lot of very surprised individuals to see how close they may have come to an answer, and yet just how far they may be from an answer. Looking back at the results, I'm reminded of when I was an intern and I first began treating COPD patients, chronic obstructive pulmonary disease patients who would frequently come into the hospital with infections. They were predisposed to them, and they would frequently acquire, more often than not, bacterial infections, but sometimes viral and fungal infections. If we'd have been thinking more along those lines when we started looking at COVID-19, we'd have probably come to the answer sooner. But it's always interesting to reflect that the answers are always easy to understand once they're discovered. The trick is to discover them.